Good evening, everyone. Today I'll continue with the malaria part 2. So in the previous class, we have seen some historical significant points related to malaria and also the life cycle in detail of Plasmodium species and also the various Plasmodium species which causes what and different types of the malarial fever. So as a part of continuation, so just to brush up over here, so merozoites. So merozoites are the one which has got the invasive property. Roshan, can you hear me? Roshan, am I audible, Roshan?
Yes,
Yes,
madam,
ma'am.
you are audible, madam.
Okay, Roshan.
Yes,
So
ma'am.
in the malaria, very important thing is that the merozoites. So which are the product of what? Caesogony. Caesogony means what? Caeso means what? Split. So when what happens, the sporozoites when they enter the what circulation get into the hepatocytes and the division whatever happens and later they get out in the form of the merozoites, and these merozoites are taken up by the further RBC. They transform into trophozoites and then later they transform into further division forms which are called as merozoites. So these merozoites are exclusively invasive in nature. So this is one of the very important MCQ question. Then after that, the merozoites in the RBC, they convert into ring stage, and this ring stage further divides and becomes trophozoites and followed by the merozoites. And very important, why Plasmodium falciparum is highly virulent? So it is basically because of the presence of more number of merozoites. So greater the number of merozoites, then what happens? Greater is the virulence of that particular Plasmodium. So it is directly related to each other. So why Plasmodium falciparum is highly virulent? It is one of the reason is because of the presence of more number of merozoites. And the merozoites further divide to produce the gametocytes, and these gametocytes can be what? Male or female gametocytes. And these gametocytes are what? Infective form for what, students? It is infective form for the mosquito. So the mosquito, it takes up these sexual forms of this Plasmodium, and it again further divisions and union to form the zygote will take place within the mosquito. Now coming to the individual species of the Plasmodium. So the first and very important is Plasmodium vivax. So it is one of the most common Plasmodium species, and it has got a wider geographical distribution. Nearly 80% of the malaria in the world is attributed to what? Plasmodium vivax. So a question can be asked. So which of the following Plasmodium species has got a wider geographic distribution? Or nearly 80% cases of malaria in the world are caused due to which one? So it is basically due to which one, students? It is basically due to Plasmodium vivax. And very important is it is most commonly seen in Asia and America. So what about the Africa? So Africa, which is most common, it is Plasmodium falciparum. So this is very important point. So Plasmodium vivax, it is most commonly seen in the Asia and America and less common in Africa. And it causes a type of malaria called as benign tertian malaria. That means what? Tertian means every third day there will be fever. So the patient will complain or show the symptoms of fever every third day. And it definitely coincides with the which one, students? It coincides with the lysis of the RBC. So every third day there will be breakdown of the RBCs, and that third day the patient will be presenting with a clinical manifestation. And a very important thing is that this Plasmodium vivax, this sporozoid form. So where do we see the sporozoids? These sporozoids are the ones which are seen in the mosquito, and it is the infective form for what? Man. So in the mosquito, thin, slender, sickle shaped, or like curved narrow structures are seen called as sporozoids. And these sporozoids, once they are injected into the human, so then they will undergo the further stages of their life cycle. And there are two types of sporozoites. One is tachysporozoites, another is bradysporozoites. Again, a very important question. So which of the following sporozoite of Plasmodium vivax is responsible for the what? Relapse. So relapse is basically because of what? Brady. So brady means what? Slow. The meaning of brady is what? Slow. So that means what? These are the type of sporozoites of Plasmodium vivax which divide very slowly, and they remain within the liver cells or the hepatocytes in the form of the dormant forms called as hypnozoites. So under the favorable conditions, they reactivate and then they undergo the rest of the parts of their life cycle to produce a clinical manifestation. So bradysporozoites are the one which are responsible for what? Relapse. And these are the ones which get converted into what? Hypnozoites. And tachysporozoites are what? Fast dividing. Tachy means what? Fast. So these are the ones which are responsible for what, students? It is the one which is responsible for the clinical manifestations and also the normal life cycle continuation. Coming to the geographic distribution of this Plasmodium vivax and the Plasmodium falciparum. So very important what you can observe over here. Plasmodium falciparum, the distribution is more commonly seen in the sub-Saharan region. So if you see, this is the Saharan area. Sub means below the Saharan area. The entire part of the Africa is affected with the Plasmodium falciparum. So sub-Saharan area, it is the one which is like hallmark for what? The geographic distribution of what? Plasmodium falciparum. Whereas if you see Plasmodium vivax, look at the map over here. Roshan, can you see over here? So in this map, what you can see is that other than
Yes,
Africa,
ma'am.
rest of the parts of the India and also the Asian parts, and also if you see this map very carefully, the South America, the down part and also the central part of the America. So these are the areas which are the common endemic zones for Plasmodium vivax. So which are the endemic zones for Plasmodium vivax? It is the
Asia
American.
and America.
Yeah, very good, excellent answer. Asia and the American areas. So these are the endemic areas. Next. In Plasmodium vivax, very important is that the dormant forms or the sleeping forms called as hypno. Hypno means what? The sleeping forms. It is most commonly seen in the Plasmodium vivax, and also it is most commonly seen in Plasmodium ovale. And the merozoites, that is the like products of the sesogony, that is the divided forms. They basically affects which one? Young RBCs, which are referred to as what? They are referred to as reticulocytes. So this is very important MCQ question. So Plasmodium vivax. So vivax, it is the one which affects the younger RBCs. And there is a very less amount of parasitemia. Why there is a less amount of parasitemia, students? May I know one more student who has joined this classroom? Good name? Is it Suchet?
Yes, ma'am.
Okay. Roshan, like Roshan and Suchet, can you tell me why the parasitemia is less in case of Plasmodium vivax? Because in RBC, if you see, there will be young RBC, intermediate,
And old RBC, ma'am.
old RBCs.
Yeah,
So it is the one
both
which,
are affected in
huh,
uh, falciparum, but a Vivax is only
the
new
young
RBC is affected.
RBCs. Excellent answer. Since only younger RBCs are affected, so therefore what happens? Lesser severity of this particular Plasmodium vivax. So therefore there will be less parasitemia and only 2 to 5% of RBCs are affected. In PBS, that is in peripheral blood smear, if you see, you can see all the three stages of this Plasmodium vivax, that is trophozoites. Trophozoites are what? They are the feeding forms. And then next is the scisons. They are the dividing forms. They are the dividing forms. And then the gametocytes, they are the sexual forms. So all the three stages of the Plasmodium are seen in the peripheral blood smear of the Plasmodium vivax. Whereas in Plasmodium falciparum, if you observe what can be seen, students, what is the major difference? In peripheral blood smear, can you see all these three forms? Yes or no? No.
No, ma'am.
We can only see the ring forms, because what happens, the rest of the forms, if you want to see, because they'll be already entering into the circulation, supplying the vital organs like brain, spleen, and other systems of the body. So in the peripheral blood smear, we can't see trophozoites, isons, or anything. Only the matured gametocytes, only that can be seen, or only ring form can be seen in case of Plasmodium falciparum. And very important in case of vivax is that the gametocyte, they have got no proper shape. This is very important. So can you appreciate this picture over here, students? So in this picture, what you can see, look at this blood smear picture. So it is something like there is no proper shape, some irregular shape, and it is occupying almost all the entire size of the RBC. So this is one of the important feature over here. And very important is this Vivax, wax, max. This point is very important. So the Plasmodium vivax, it has the capability to increase the size of the RBCs. So RBCs looks how they look very much distorted. This is very, very important clinical feature. So under the peripheral blood smear, what you can see, students, Suchet, Roshan and all. So you can see enlarged or distorted RBC. This is one of the
Distorted.
pathognomic feature. And what is the incubation period? So it is a time for the entry of the sporozoites and then the clinical manifestation by the patient. So that is the incubation period. And how much it will be? It will be more than 2 weeks. And very important, it will lead to what? Relapse. And there is no recrudescence. So it will lead to what? Relapse, and there won't be any recrudescence, right? So these are the general points related to Plasmodium vivax. Now let us see some of the very important what histopathological features of this Plasmodium vivax. And most of the questions are asked in relation to these points only. So ring form. So what is this first peripheral blood smear it is showing, students? Can you all observe this ring form? Roshan, Sirisha, Suchet,
Yes, ma'am.
others. So it is
Yes, ma'am.
something exactly looking like a finger ring. So that is signet ring form. So
Cultivar.
look at this. This part is nothing but the nucleus, and central what empty area is nothing but the what? Vacuole.
You.
Okay. And then the peripheral rim is nothing but it is a push, the cytoplasm is pushed to the periphery. And very important point is that you need to observe here is one area is thin. Can you observe here? This part is thin and this part of the ring is thick. So what you can see, the ring form also, in the ring, one part of the ring is thin. Another part of the ring is what? It is thick. So that means what? It is like thick and thin resemblance of the ring form, and it is one of the characteristic feature of which one, students? Plasmodium vivax. And where is the nucleus attached? Nucleus is present near the thin section of the ring form. Look at this. So nowadays most of the questions are image based. So if this particular image is given and if it is asked for you, so like identify what type of Plasmodium it is. So look at the ring. Okay, this side it is thin and this side it is thicker ring, and nucleus is totally present, or it is more inclined towards what? Thin side. So it is a what confirmatory for Plasmodium vivax. Next, this is another peripheral blood smear where you can see what? Trophocyte. Can you see it is something? What is the shape of the trophocyte over here? It is something like an amoeboid shape, that is shapeless. So it is like active and it is motile. So if you see more distorted trophocyte, that means what? It is highly motile. So it is like moving trophocyte, and it is very important feature of this Plasmodium vivax. And if you see Plasmodium ovale, there also you can see some distorted like amoeboid shaped trophocyte. But the thing is that that particular trophocyte is not that much mobile as compared to that of the Plasmodium vivax. So this is one of the differentiating point. So if you see something less distorted trophocyte, then it is Plasmodium ovale. Yes. And one more thing, can you look at this third peripheral blood smear, students? So this is the first one, and this is the second one, and third one. In the third one, what you can see, students, just below the surface of RBC, you can see some dots, right? Yes or no, Roshan, Suchet, Sirisha, others?
Yes,
Yes,
ma'am.
ma'am.
So what are these dots? They are called as. So these dots or granular type of structures are called as what? They are called as what? Stippling. So they are called as stippling or dots or the granules. So like some multiple brick red color dots you can see. And they are just present below the RBC or on the surface of the RBC also you can say. And they are called as what? Schaffner's dots. This point is very, very important. And it is also pathognomic feature of what? Plasmodium vivax. So Schaffner's dots. And what are these dots exactly? So it is like we don't know exact function of these dots, but it is believed that so like the RBC surface membrane. So what happens? It will just invaginate and it will form a caveola vesicles. So like it is an invagination of the surface region of the RBC within the into this center part of the RBCs, and they get detached and they form a small vacuole type of structures. And these complex, it resembles in the form of a dot, and it is referred to as what? Schaffner's dots. And it is assumed that these are the ones which contain the antigens of what? Plasmodium vivax. So what does this Schaffner's dots they contain, students? It contains what? Plasmodium vivax antigens. So it is like they are the ones which are responsible for causing all the destructive manifestations, right? And then one more thing is that if you look at this fourth blood picture, so what you can see in the fourth blood picture, so in the fourth blood picture, very important is that rosette appearance. Rosette means what? Center one pigment will be present. That is a pigment, that is hemoglobin pigment. It will be broken down and taken up by the trophocyte, and it gets converted into what? Hemozoin. It will be converted into hemozoin, right? If it is not converted into hemozoin, then what will happen? It will be dangerous for the plasmodium itself. So what happens surrounding this pigment, there will be what? The products of division, that is called as what? Merozoites. So there will be merozoites, and they'll be peculiarly arranged in a fashion, and that fashion we call it as what? Rosette appearance, right? And where do we see this rosette appearance? In Plasmodium vivax, and also in case of Plasmodium malariae. So these are the two important points you need to remember. So what are the pathognomic features, students? One is ring form. In the ring form, what you can see, students? Look at this first picture.
One side is thick and one side is
Another side is thin. Very good. And second one is trophocyte, highly amoeboid, totally distorted, and it is actively motile. The third point is that you can definitely observe Schaffner's dots. And what are these dots? They are supposed to be, they are the one antigens of the Plasmodium vivax. Next. What is this malariotherapy, students? What do you mean by this? What is malariotherapy? Suchet, Sirisha, Roshan, anybody, students?
Treatment.
So it is basically what it was been assumed that during early 1970s, especially by Julius Wagner. So what he has assumed that if the body temperature is raised, then that raise in body temperature will be lethal to other mycopathogenic organism. So that is what we call it as what? Pyrotherapy. Pyro means what?
temperature related.
Rise in temperature. Now when we
Temperature.
increase the temperature, that rise of temperature will kill some other organism. So based on this principle, what happened in 1917, Julius Wagner, remember this person? So because nowadays the pictures also they can give these people who invented what and all. So this person Wagner, he has introduced malariotherapy. Malariotherapy means what? He has inoculated Plasmodium vivax into the person who is suffering from tertiary syphilis. So where there will be what? CNS involvement. Where there will be CNS involvement. And this syphilis is caused by which one, students? Treponema pallidum. Right? Now, based on his logic, what he felt that when Plasmodium vivax was inoculated, then the person will get malaria. And then because of malaria, the body temperature will rise. And this rise in body temperature will kill what? The bacteria, that is Treponema pallidum, right? So now this Treponema pallidum, what happens? It will get totally destroyed because of this rise in body temperature. But the problem what happened, like it was like a wonderful treatment. Look at this picture. They were behind, who is this person? This is the person who is affected with malaria. So from him the blood was taken, and that blood containing this malarial parasite, it was inoculated into the person containing syphilis. And now what happened? This person who got syphilis, now again he will get the malaria, and simultaneously what the treatment line? The person will be given treatment for malaria also. So one side treatment for malaria, he'll be getting care for malaria, and this malaria in turn it will kill what? Syphilis. So this was what is the thing logic behind this. But what happened? It the thing is that we saw like there were certain cases, nearly 15% of the patients who were killed because of the malaria. Like we were able to treat a tertiary syphilis, but unfortunately patient died because of the complications of the malaria. So because of this, after 1940, this particular malariotherapy has been discontinued and it is no longer in use. But however, Julius Wagner, he was the person who has been awarded with the Nobel Prize because of this malariotherapy. So in malariotherapy, which species of plasmodium use, students? Very important MCQ question. So what is it?
Vivax.
Vivax. So keep this point in your mind. So Plasmodium vivax for what? Malariotherapy. And malariotherapy is a type of what? Pyrotherapy. So this point you need to remember. Next, coming to Plasmodium falciparum. So what is the thing about Plasmodium falciparum? Just Roshan, as Roshan said, so it is the one which affects the RBCs of all the age groups. Now, since all the young, middle and older RBCs all are affected, so what will happen? There will be higher degree of parasitemia. And because of this, what happens? RBCs loaded with parasites, and once it cannot accommodate, RBCs will break or burst over. So this will result in what? Massive hemolysis. So because of massive hemolysis, what will happen? It will lead to a condition called as prehepatic jaundice, right? And very important thing is that this is also very important. What is the incubation period? Incubation period of falciparum is what? Less than 2 weeks. It is less than 2 weeks. That is the shortest incubation period. And this is also one of the very important MCQ question, right? And because of the shortest incubation period, what happens? The virulence will be again high. And very important is that in the RBCs, in the peripheral blood smear, what we can see, students? Only the ring stage. But if you want to see the merozoites and the trophozoites, then it is not possible because those stages will happen within the vital organs. Then what else you can see, students? Maurer's clefts. So what are these cleft? Cleft means what? They're something like pockets there. So they are like some structures, they resemble like this pocket type of structures, some elongated structures. So this is a picture of the electron microscope. Can you all appreciate, students? Roshan, Sirisha, Suchet.
Yes, ma'am.
So what you
Yes,
all can see over here. So look, this is a so electron microscopic structure. So they are like lamellated, that is leaf-like, layer-like arrangement. And these are something like these structures. They are present within the RBCs. If you see, then it is pakka or confirmed for what? Plasmodium falciparum. But in the RBCs, if you see some dots, so then you can think of what? Plasmodium vivax, which are called as what? Sharpness dots, right? And what are these Maurer's clefts there? What exactly they do? So we don't know exact role of this Maurer's cleft, but it is assumed that these are the ones which help in the transport of the food. Like there will be like a transport of the food from the plasmodium falciparum to the RBCs and to the outside of the RBCs. So something it is felt that it might be the one which helps in the transport mechanism of the products that are required for the growth and the development of plasmodium falciparum. So Maurer's clefts, it is seen in which one? Plasmodium falciparum. So remember this one, FM. So falciparum, radio FM, you all like if you remember that, or forensic medicine also like FM. Falciparum, what you can see? Maurer's clefts, right? And what is the malaria type of malaria named over here? It is called as malignant. Malignant means very severe and it is very fatal type of malaria and it is tertian malaria. That is, the fever occurs every 48 hours and here all the RBCs are involved. And very important thing you have to remember, students. Can you see this peripheral blood smear? What you can see here, students? What stage you all can see? Roshan,
Ring stage.
Sirisha, Suchet.
Ring stage.
It is ring stage.
ring stage,
Excellent.
ma'am.
Yeah, but in ring stage, what you can see, look at the periphery of the RBC. Where are these rings present over here? They are present on the periphery of the RBC.
Very.
Yeah, they are called as what? Echoal forms. So this is one of the very important pathognomic punching point it is. If echoal forms are seen, done. I am confirmed with my Plasmodium falciparum. If Maurer's cleft are there, then again it is a pathognomic, right? Then what else you can see? Can you see here something like a headphone? How does a headphone will look like? Like this, right?
Yes.
Yes or no, students? So
Yes.
this stereo headphone appearance, If it is seen within the RBC, then it is also what? A pathognomic feature of what? Plasmodium falciparum. So what does this stereo headphone represents? It is a binucleated structure. So ring form will be there. Usually ring form, it contains one nucleus. But here what happens if there are two nucleus, then it gives a shape of what? Headphone appearance. So this point you need to remember. So echo forms or stereo headphones, they are seen in which one? Plasmodium falciparum. Next. Look at this particular blood smear, peripheral blood smear. What you can see over here, students? A kidney shaped or half moon shaped, right? Can you appreciate this, all of you? Yes, Roshan,
Yes,
Suchet.
ma'am.
Yes, ma'am.
So what does it mean? So it is nothing but the gametocyte. So it is the sexual form of this Plasmodium falciparum. So kidney shaped or the crescent shaped structures, these are the pathognomic feature of Plasmodium falciparum. That is banana shaped or kidney shaped. Remember this. And can you see the sleeping forms? Does this fellow will sleep?
Hypnozoids. No, ma'am.
No hypnosis because this fellow is highly virulent. So where is the time for him to sleep over there? He is like actively working to kill the host only. I will kill, I will affect all the RBCs. So he is like a very much active fellow. So always an active fellow will never have the sleeping stage. So therefore there is no hypnozoids seen in Plasmodium falciparum. And in one of the recent, I think Roshan, you must have seen, right? A recent NEET exam like Plasmodium falciparum and malaria, this question has been asked, in which one of the following hypnozoids are not seen? So it is not seen in which one? Plasmodium falciparum and Plasmodium
Malaria.
malariae. And one more thing you have to remember is that gametocytes, that is sexual forms, are more in the blood of the babies, that is who age between 9 months to 2 years old. So therefore these babies, they are what? Infective, like they are more infectious to the mosquito. Like if the mosquito they bite these babies affected with falciparum over, so there will be more of mosquito population loaded with this Plasmodium falciparum. And where it is seen? Because sub-Saharan region. So this is one of the very important MCQ question asked. So Plasmodium falciparum most commonly seen in the sub-Saharan area. And clinical features of falciparum and malaria are almost all similar. And which is more virulent, students? Falciparum or malaria? It is falciparum.
Falciparum.
Falciparum, ma'am.
Excellent. Just a second. Some problem happened with them. Okay. Now there are some points you need to remember over here. How far, I mean, how come this Plasmodium falciparum is more virulent? So first thing we know that there are more number of merozoites, greater number of merozoites. Second thing is that it affects RBCs of all the age groups. So all the age group RBCs are affected. And the third reason is that there is a presence of Plasmodium falciparum adhesive protein. So that is Plasmodium falciparum adhesive protein, PFAP. So this is very important. So because of the presence of this adhesive, that is attaching protein, so what happens? It will alter the shape of RBCs, and this sticky protein, it will go and stick to the healthy RBCs. So this will result in what? Clumping. So one RBC will stick to each other. Why this sticking happens? It is because of the presence of this adhesive protein present on the surface of the Plasmodium falciparum. And this clumping, it will result in what? It will result in the blockage of the capillaries. So it may be complete blockage or it may be partial blockage. So ultimate end result is what? The end result is what? It will result in the ischemia of the organ supplied by this particular affected vessels. And another important reason for its higher virulence is what? This plasmod, I mean, in the humans itself, there is ICAM1. So that is intercellular adhesion molecule 1 and chondroitin sulfate B receptor and CD36, that is cluster of differentiation receptors. So these are the receptors that are present in the host or the human cells, and these receptors, they attract the Plasmodium falciparum. So wherever these receptors are there, the falciparum will go and get attached, and they will get into the the system over there, and it will continue its life cycle. And very important is that the Plasmodium falciparum, Antigens, they stimulate what? Insulin secretion. This point is very, very, very important. So the Plasmodium falciparum antigen, it will stimulate what? It will stimulate the insulin secretion. Do you all agree, students? Sirisha, Suchet, Roshan?
Yes, ma'am.
So what will happen? More and more insulin is produced, then what will happen? Person will get into hypoglycemia. Hypoglycemia, then again all the consequences of hypoglycemia person will be facing. So very important point you need to remember. Question can be asked. In which of the Plasmodium species hypoglycemia is seen? So what should be your answer? It is Plasmodium
Falciparum.
falciparum. Remember this point. And very important is that because there is a massive hemolysis, and if it is not taken care and it is happening in an uncontrolled fashion over, the patient will land up into what? The stage of shock. And finally, if not properly cared and nothing works out well, then it will lead to the death of the patient. So these are the grave consequences of Plasmodium falciparum. So I want you all to remember this particular adhesive protein, and these are the three receptors: ICAM1, chondroitin sulfate B receptor, CD36 receptors of the man. So these receptors, they attract the Plasmodium and hypoglycemia. And there are only two infections in the man, that is Bordetella and Plasmodium falciparum infection. These are the only two infections which stimulate increased production of insulin. This point you have to remember. If the MCQ is asked for you, which of the following bacteria that stimulate the production of insulin, then what should be your answer, students? It should be
Bordetella and Plasmodium falciparum.
yes. So you should read the question properly. If only bacteria is asked, it is Bordetella. If which of the following organism is asked, then it is Bordetella and Plasmodium falciparum. Or only in the Plasmodium, which is the most commonly increase the secretion of insulin, it is only Plasmodium falciparum. Now coming to the Plasmodium malariae. So malaria is the one which has got what? Longest incubation period. And Plasmodium malaria, it is the one which affects what? Older RBCs. Mother, remember, mother, MOTH here. So in the mother, what happens? The first two letters you remember. Malaria, it affects what? Students, it affects the older RBCs. So which are those older RBCs? They're almost all dying RBCs. So what happens? Therefore, the virulence is less. So anyway, RBCs, they live for shorter time. So their virulence will be less and there will be less parasitemia. And what is the important or the pathognomic clinical feature? Look at this blood picture over here. What you can see?
Bad for
Excellent. It is a band form. So it is nothing but the trophozoite, whatever is that is a feeding form or the active form of this plasmodium. It gets stretched or it gets elongated like a rubber band. So it typically gives a what? Band form appearance. Yes. So ecole form or stereo or the headphone appearance. It is a characteristic feature of which one, students?
falciparum.
Falciparum. Band form is a feature of what?
Malaria.
Excellent. And Plasmodium vivax, what is very, very important? Vivax. Wax may max. That
Seizure.
means what? RBC size will be increased or distorted. So this point you need to remember. And what you can see over here, some again dotted or granular type of structures, which are called as what? Siemens stippling. Yes, these points you need to remember. And incubation period is more than 1 month. It is the longest, and it causes what? Fever every 72 hours, which is called as what? Quartan malaria. And there is no relapse, but recrudescence can be seen. So in Plasmodium falciparum and Plasmodium malariae, there is no relapse. There is no relapse. And whereas um, in these two, what is present? Recrudescence. What is recrudescence, students? Sirisha, Roshan, Suchit. So recrudescence what? In the blood, in the peripheral blood, there will be some amount of parasites will be present all the time, but they will be in a lesser number. Yes, in the circulation. Whereas in relapse, what is the thing? Even if you take a blood smear, whatever, draw the blood sample, you don't see any parasites in the peripheral blood. In circulation, it won't be present. It will be just sleeping in the liver. So liver will be its home and it will be nicely sleeping. So it is circulation may little bit of parasites, then it will lead to recrudescence. Agar circulation mein there are no parasites, but in liver they are present, then it will lead to what? Relapse. And what is the most common complication of this Plasmodium malaria? Very, very important. A question has been asked already. It leads to what? Nephrotic syndrome. It ultimately leads to what? Renal failure. All this antigen antibody complex, it will be like deposited on the glomeruli, and it will lead to destruction of the kidney. Yes. So what is the potential complication of malaria, students? Plasmodium malaria. It is, remember, M. If you remember
Nephrotic.
the alphabets, after M, what happens? That is malaria. It will cause what? Complication is nephrotic syndrome. Remember this way. Next. Coming to oval. So very important thing is that the clinical features or the peripheral blood smear of the oval and Vivax, almost all they are same only. Like some minor differences are there which you need to remember here. Thing is that oval and Vivax has got sleeping forms, that is hypnozoites are present. Wherever hypnozoites are present, always relapse will happen. And it is the rarest of all the Plasmodium. Question can be asked, which of the following is the rarest? It is what? Plasmodium oval. And it affects the younger RBCs. It doesn't like all RBCs or the older one. It is like Aramse it will affect the younger RBCs. And there is no increase in size of RBC, but there is a change in shape of the RBC. This point to remember. Look at this peripheral blood smear, students. Can you all see here? Students, Roshan,
Yes, ma'am.
Suchet, and
Yes,
others. So, what is the shape of the RBC here?
ma'am.
It is oval shaped. So, something
Oval.
oval shaped RBC, that's why it is called as Plasmodium oval. And trophozoites are less amoeboid, like they are not much actively motile and they are less distorted in shape, whereas more amoeboid trophozoites are seen in which one? Plasmodium vivax. And very important is that yellow color pigment you can see. So very, very important, remember this, because in Plasmodium falciparum, what type of pigment you can see? Black pigment. Because massive hemolysis, RBCs are breaking. So this breaking results in the deposition of what? Black color pigment. But here not much of the RBCs or hemoglobin, they're not much destructed, so you can see a light yellow color pigments. And here also you can see some just below the surface of the RBC, some dots. Can you see here? Dots over here. So those dots are called as what? James dots. So which are something like a pear shaped dots that are seen in the ring forms. So these dots, if you see properly, they are some pear shaped drops. So even the exact mechanism or the role of these dots are not understood. And very important thing is that if you observe the RBCs, sometimes these RBCs will have what? Some finger shaped projections. So they are called as what? Fimbriae. So the RBCs containing fimbriated or the finger shaped projections, which are common feature of what? Plasmodium ovale. And there is no special complications or any such what very big problem is associated with the oval. This point you need to remember. And incubation period of Plasmodium falciparum and vivax is almost all same. So clinical feature of Plasmodium ovale and Plasmodium vivax, these two are same. Yes. And very important is that clinical feature of Plasmodium falciparum without complication and clinical feature of Plasmodium malaria, these are also almost all same. So just to brush up the points over here, Plasmodium falciparum, what type of pigment you can see, students? Black
Black,
pigment. Plasmodium malariae, brown color pigment. Vivax and oval, what color pigment you can see, students?
yellow,
Yellow color
yellow brown.
pigment. So black means falciparum. Falciparum is the most dangerous fellow. So always black color can be seen. Now coming to the clinical features of the malaria. So there will be periods of like chills and the fevers will be there. Along with that, there will be anemia. Why anemia? Because of the lysis of the RBCs. It
Harvest.
results in what? Anemia. And apart from anemia, there will be spleen enlargement, that is splenomegaly, and there will be hepatomegaly. And if you look at into this febrile paroxysms, like the fever stages, usually the fever occurs in the afternoon. And these febrile paroxysms, they really, I mean, they exactly match with the what erythrocytic lysis. That is, once the RBCs they are ruptured or burst, that time the fever will be seen. So it happens in the three following stages. That is a cold stage, where there will be patient will be feeling intense cold for 15 minutes to 1 hour, and hot stage, that is cold stage is followed by hot stage, where the patient temperature will be raised more than 41 degrees, and this also will extend from 2 to 6 hours. And there will be sweating stage, where the temperature will come down and the patient will feel cool and moist. And other clinical feature is that spleen. If you see the spleen, what is the color of the spleen? How does it look? If it is like chronic malaria, the spleen color will be slate gray or black in color. It is basically due to the accumulation of the pigments. And if it is like acute or like in the fresh this thing, then the spleen will be felt soft, and it will be moderately enlarged, and it is also congested. And if it is a chronic malaria infection, then the spleen will be hard with a thick capsule. And if you observe the liver, there will be hepatomegaly, and there will be increased number of Kupffer cells. And these cells, they contain what? Parasites. And apart from that, there will be fatty degeneration. And other organs that are affected will be kidney. So there will be enlarged kidneys, and kidney will be congested with the malarial pigments. And apart from that, there will be anemia. And just to list the complications of the malaria, that is a Plasmodium falciparum, because all this will be taken in detail by the Dr. Umesh. So complications of the Plasmodium falciparum. So what are the complications, students? One is cerebral
Cerebral.
malaria. So this Plasmodium falciparum, it will cross the blood-brain barrier, it will enter the CNS, and there it will cause a destructive lesions. Then apart from that, there will be black water fever. What do you mean by black water fever? That is blackish color urination. That is hemoglobinuric nephrosis. And egglid malaria, that is the patient will be presenting with shock. And there will be septicemia, where multiple organs are affected with the falciparum, and it will lead to the dysfunction of those organs. Then one more important thing is that, very important, like once an MCQ has been asked related to this. What is the infective form of malaria to the man, students? How do we get infected? Mosquito. Yes, in the mosquito, what is present?
Sporozoite.
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 So infective form to us is sporozoite. Now there are certain situations where sporozoite may not be infective to us. It may be trophozoite. Where are these trophozoites present, students? Trophozoites are present in the RBC, that is
RBC.
the red blood cells of the man. So now that is trophozoite induced malaria. It is a little bit different one, but it can also happen in what situation? It can happen in case of malaria infected blood. If it is transfused to some other person, healthy person, so that person may catch up what? Malaria. So in that infected blood, what will be present? Trophozoites. Yes. So trophozoite induced malaria can happen in case of transfusion, or it can happen in case of congenital malaria, that is mother to baby, or in case of renal transplantation. That means if you are transplanting the kidney from a malaria affected person, then chances that the healthy non-malaria person may get the malaria because of this infected kidney transplantation, or because of the shared syringes, right? So these are all the different causes for the trophozoite induced malaria. Now let us see some of the MCQ. The infective form of malaria parasite through a blood transfusion, because once this question has been asked. So what is the infective form,
Tropho-
students?
First, trophozoite.
Trophozoite.
So shall you all agree to this?
Trophozoites.
Yeah, it is a straightforward question. So it is trophozoite. If it is from mosquito, it is asked, or the natural way, then
Sporozoite.
it is sporozoite. Next, peaks of fever in malaria coincide with the release of successive broods of dash into the bloodstream. Like fever will be there. Why the fever will occur? when the lysis of the RBCs will happen. The broken RB from the broken RBCs, what will be released, students?
Merozoites.
Excellent answer, wonderful. Suchet, Roshan, and all. So it very good, Sirisha. So it is like merozoites. What are merozoites? The products of caesogony, that is division, right? The
Infected form.
trophozoites, yeah. So the answer is which one? Merozoites. Next, old RBCs are preferentially infected by. Remember this one, mother,
Yes.
Plasmodium malariae.
Vivax.
Yes, Sirisha.
Okay.
Which one?
No, ma'am, nothing, ma'am.
Yeah. The answer is which one? It is
Malaria.
Plasmodium malaria, the second one. Yeah. Next, malarial parasite in India, all except. So, what is a malarial parasite that is seen in India except? So, we see it is like most common is Vivax, falciparum. These are the two most common. And novel C, do you think it is the most common species or no?
Ma'am, not seen.
No,
Not
ma'am.
seen. So, where it is seen? Roshan, Suchet, Sirisha, it is seen in Indonesia, and Malaysia. And it is a very important point you have to remember is that there is no human to human transmission. This is a very, very important point. No human to human transmission. And it commonly affects what? Monkey, long tailed monkey. That's why it is called as what? Simian malaria. And what is the thing over here? Fever will be seen every day. Every day fever is seen, so it is like transmitted from monkey to human, but there is no human to human transmission. Fever is seen every day. It is also called as simian malaria because the meaning of that word is nothing but monkey, and it is commonly seen in what? Indonesian malaria, and it is not present in India. So this point you have to remember. So what is the answer, students? Oval is also present. So oval, like recently cases are reported from Orissa and Gujarat. This point you have to remember. Otherwise, we don't see much in India oval, less commonly seen. But these are the two most commonly seen, especially in the Orissa. Yes. So the answer is what, students? Third one. Next. Most common malaria causing species in India and world. Roshan, Suchet, Sirisha.
Falciparum.
So yes, very good. So in India and also in the world, the most common malaria causing species is what? Falciparum. Yes, and the least common is what? If they
Ubari.
ask the question, least common is oval. So this point you have to remember. Next, Plasmodium with the shortest incubation period. Shortest means what? Highly virulent. So what is the answer,
Less
student?
than 2 weeks.
Yeah, less than 2 weeks. Excellent.
Vivax.
Falciparum. So look at the table. It is falciparum only. It's a straightforward question. And if the question is asked longest incubation period means
Malaria.
longest.
More than
You
malaria.
no, longest is what? Malaria.
20.
See, in
Malaria.
malaria, no, L is there. L is for what? Longest. So malaria may longest incubation period and affects the older RBCs and less virulent, right? And falciparum is the one with shortest incubation period. So the answer is which one? First one, right? Okay. Read the question carefully. Vector for rural malaria is Anopheles culicifacies. Vector for urban malaria is Anopheles Stephensi. Above statement is. Now read this statement and they read the options also. Only statement A is true. Only statement B is true, or both statements are true, or statement A is true and B is false. What is the answer, students? Roshan, Sirisha, Suchet. See, rural
Malaria.
malaria. That is a malaria that is seen in the rural areas of India. So, because of the unhygienic conditions and all, there will be breeding of the mosquitoes. So, just remember RCC, RCC slab, something you remember, no? Rural malaria is caused by Anopheles culicifacies. Just remember this way. Yes, urban malaria, us, or United States. Just remember this. Urban malaria, USA. Urban, that is Anopheles Stephensi. Just remember these mnemonics. So that is what both the things are right only, right? Both the statements. Because many times this question has been asked. Roshan, Sirisha, Suchet.
Yes, ma'am.
So what is the answer over here now? What
Both
should
A
we
and
take?
D.
Yeah, both A and B are right, right? In urban malaria, because of the slums, lot of slums, and because of the like a lot of construction activities and all, the urban malaria has become more rapid, and there Stephensi mosquito breeding occurs very popularly. So RCC, US, United States, just remember this way. Next, James dots are seen in. What are these James dots in the RBC? So in the
Yes.
RBC, some granular structures are seen. So these granular structures called as James dots. So these are seen in which one, students?
Vivax.
Not Vivax, it is Vivax. What we
Okay.
can see? Schaffner's dots. Actually, James dots are also called as Schaffner's dots. Both are like we can say either of the way.
Also.
But no. Falciparum, what you can see? FM, forensic medicine, or FM radio. So
Morens clefts.
very good. So this is not the answer for us. So among these two only it will be present. Because in malaria we can see Siemens stippling.
Gemens.
So
Oh,
here,
well.
no, it is Plasmodium ovale. Yes, Vivax means Schaffner's dots. Schaffner's dots are seen in Plasmodium vivax. James dots are seen in Plasmodium ovale. So in the James you just see A is, you just make this A as 0. That is like O. So then you remember it as Plasmodium ovale. Yes? Yes, students? Next.
Yes.
Yes, ma'am.
Okay. Black pigment of malaria is seen with.
Falciparum.
Calciparum.
Okay, ma'am. First.
Wonderful answer it is. Too good. So it is seen with what? Plasmodium falciparum. Straightforward question. In rest of the things it will be brown or yellowish in color. Next. Relapse of malaria is not seen with. We don't see the relapse. That means what he is
Falciparum.
saying? Recrudescence.
Falciparum.
Calciparum.
Malaria.
Falciparum.
Falciparum and malaria. There are two
Malaria.
right answers over here. Very good. And these are the two which has got what?
Relapse.
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 Very good. Next, sporogony phase of Plasmodium corresponds to. Sporogony means what? Sporozoite formation. It happens in what? Man or mosquito?
Mosquito.
Wonderful answer. It happens in what? Mosquito.
Mosquito.
And this is what? Sporogony is nothing but sexual phase. Sexual means what? Union of male and female gametocytes. This ultimately results in the formation of a zygote, and it will undergo subsequent divisions, ooconite, oocyst, and it will lead to the thin, slender structures called as sporozoites. So all this happen in what? Mosquito. The union happens in mosquito. Therefore, it is called as mosquito is called as what? Definitive host, where the sexual cycle will takes place. Now look at the option over here. Sporogony phase of Plasmodium corresponds to infective form to man. Do we all agree with this?
Yes, ma'am.
No.
No, ma'am.
No.
Sex.
Yes.
Both are answered correct.
Both are right actually. Both the answers are right. Because no, like the sporozoites, that is it end product of this sporogony, they are infective to man. Yes? Yes, Sirisha. Then what happens? It is also the sexual phase. It is also called as exogenous phase. That is happening outside the man.
Outside.
So it is called as exogenous. What is endogenous phase of Plasmodium life cycle?
In human beings.
Excellent answer, Sirisha.
Sexual.
Wonderful. Too good. Yeah. Yes, Roshan. So endogenous, it is nothing but asexual form. It happens in the man, and man is referred to as what? Intermediate host. So rest of the other options, look at the third option, seen in male Anopheles mosquito. Is it seen in male or female?
Female.
It will happen only in
Female.
female because now this male it doesn't suck the blood only. It only wants a flower nectar. So this point is very important. So the malaria is transmitted only by the female Anopheles mosquito, whereas no all this ridweed bug and all those other disease causing vectors no in that both male and females they are involved. But here what happens only females are involved because they need the blood to continue their progeny, their life cycle, mosquito life cycle. Next, complete life cycle of plasmodium was given by. Who has
Ronald Ross.
described? Yeah, tell me, Sirisha.
Ronaldo.
Ronald Ross.
Ronald Ross, Suchet,
No, ma'am.
God.
Ma'am, Ronald
God.
Ross gave sexual cycle only.
he has given
Like,
sexual cycle only. That is also correct. So, like sexual cycle and asexual cycle was given by whom? Golgi. So he has given what? Asexual. But if the options are like this, the complete life cycle, or if the description, if something given like this, you can opt for this first option. As Suchet said, it is only the sexual cycle. I mean, but otherwise, if the option is given complete life cycle, it is given by Ronald Ross. And just look at this slide over here. In the last class also, I described you Laveran. He was the one who is a French army surgeon who discovered plasmodium. Look at, remember these people's faces because their picture can be given and they can be asked for you. Who are these famous people in relation to what plasmodium or malaria, right? So the first person, all these people, they won what? They all won Nobel Prize. So Lavaran, he was awarded with the Nobel Prize for discovering plasmodium in the year 1907. Whereas in 1902, Sir Ronald Ross, he has been awarded with what? He has been awarded with Nobel Prize for describing the sexual phase of life cycle. That means he studied the life cycle of the plasmodium in the mosquito. And next thing is that who is this lady student? Even this lady, she can be asked to you. Who is she? She is the one who has described artemisinin. So this is a herbal drug which is like now used as a line of treatment for Plasmodium
Artemether.
falciparum. And for
Yes,
this she
yes.
has received the Nobel Prize and she is still alive. And somewhere nearly 80 plus 80 only she is. So she is basically from China and she is the first Chinese woman to get this Nobel Prize. So look at the option. The option they have given this lady's name also. Next. One more section we need to describe over here. What is malariometric indices? Malariometric means what? Like malaria measuring indices means what? They are the instruments that describe the situation. So we have got two types of malariometric indices. One is old, another is new. So there are two old malariometric indices, that is spleen rate. Spleen rate means what? It is a percentage of the children who are between the age group of 2 to 10 years showing spleen enlargement. And what is the significance of this? It measures the endemicity of the malaria in that given community. So if you go to any community and if you observe the percentage of the children affected with this spleen enlargement, so because of malaria, then it tells about the endemicity. And second type of malariometric index is infant parasite rate, IPR. So what do you mean by this? It is nothing but the parasites in the infant body. So it is a most sensitive index indicating the recent transmission of malaria in the community. So if there is a recent transmission of malaria in the community, then you have to look for what? The parasites that are present in the infant body. Who are infants? They are the ones who are less than 1 year of age. So if you find the parasites in the infants, and it indicates what? Recent transmission of malaria. And newer malariometric indices, like the newer ones, there are four indices are present. So the one is annual parasite incidence. Remember this because once an MCQ has been asked, what does API? It stands for API, annual parasite index or annual parasite incidence. What does this I stands for, students? It stands for annual parasite incidence. And what is its incidence means nothing but number of new cases or the confirmed cases divided by the denominator is what? The total number of population under surveillance, and the multiplier is what? It is 1000. And the second thing is that annual blood examination rate, that is ABER. It is always expressed as percentage. And what is the formula for this? It is the number of slides examined divided by the population they are taken into consideration. And the multiplier is what? 100. So that's why it is always expressed as percentage. So what is the significance of these two? So the API, that is annual parasite incidence, it will signifies the malaria control, like how effectively the malaria control program is happening. And it is very important for that particular purpose. And ABER, it is important for operational, to check the operational efficiency, like how far like the malaria control programs they are working out well or no. And other malariametric indices are slide positivity rate, that is number of slides showing the parasites divided by the total number of slides examined, and it is also expressed as percentage because multiplier is 100. And another one is slide falciparum rate, that is SFR, nothing but percentage of the slides which are positive for Plasmodium falciparum. Next, we will see one more MCQ question. Which is the first licensed vaccine for malaria? Roshan, Sirisha, Suchet, anybody? Which is the licensed vaccine?
Option 4.
OPV is nothing but
Mysterix.
oral polio vaccine. It's not the thing for malaria.
Option 4.
For Sirisha,
Mysterix.
yeah.
Yes,
Roshan,
ma'am.
Suchet, we'll all opt for this one only, no?
Yes,
Mosquirix.
ma'am. Yes, ma'am. Yes, ma'am.
So it is the first licensed malaria vaccine. So the fourth one is the right option. Let us see some points related to this particular vaccine. It usually comes in this twin form. So one is the lyophilized vaccine, another is the adjuvant. So we need to mix them properly. So before injecting into the subject or the patient or the child. So the thing is that it is the first world's licensed vaccine, and it was first used in African babies in the month of July 2015. And it is a recombinant vaccine. It was developed by GlaxoSmithKline company, that is British or UK based company. This point you need to remember. It is a recombinant. That means what? Some combinations we have done over here. So what combinations we have done? This porozoite, that is thin spindle shaped forms, on in this there will be some antigens are present. So this antigen we have combined it with which one, students? That is hepatitis B surface antigen. So these two we combined it. So what is this circumsporozoite antigen? It is the antigen of the Plasmodium falciparum. So we have combined the circumsporozoite protein or the antigen of the Plasmodium falciparum with that of the hepatitis B surface antigen. Why did we combine these two, students? What is the need to combine these two? Roshan, Sirisha, Suchet. What might be the possible reason?
Liver.
No. The thing what happened? No, otherwise no. Just if we use only the Plasmodium falciparum antigen surface antigen, it cannot induce lot of antibodies in the humans. Like immunogenic capacity is very less. It is less immunogenic. So to increase its immunogenic capacity, we have combined it with the like hepatitis B surface antigen. So this combination enhanced its immunogenic capacity. So this is one of the reason for recombinant technique, right? So this reason you need to remember. And what is the strain used over here? That is RTSS. So this point you need to remember. It is a very important MCQ question which has been asked. So in this RTS, what is this R, T and S they stand for? So don't break much of your head. So it is RTS a strain that is used. In this, R stands for central repeat region of Plasmodium falciparum circumsporozoite protein. That is repeat, like central area of the sporozoite. So that area has been repeatedly, it has been cloned and that particular thing has been taken. And T stands for T cell epitope of this one, circumsporozoid protein, and S stands for surface antigen of hepatitis B. So this is a full form of RTS. And what is the efficacy? It is less effective. That is the reason why WHO has not still openly said that you can, all the countries can go ahead with this vaccination. Still, the trials are going on in India, and in India, it has been thought earlier. It was decided that this year, 2020, we should conduct a good number of trials related to this malaria vaccine. But because of this pandemic, things have been halted. And what is the route of administration of this vaccine? It is intramuscular. And the recommended doses, usually it has been recommended that 3 doses are required. That is uh, like 0 dose, first dose, and second dose. That is 0, 1, 2, and 3 months interval. The age at which we have to start is at the 6 months of age. So these are the some points you need to remember. And one more MCQ has been asked related to malaria vaccine. Read the question, students. What is the specific content in malaria vaccine? What is the content, students?
Porozoite protein.
Yeah, it is like they have taken the surface porozoite protein only. So gametocytes no, lipoprotein no, none of the above is also wrong. So the only left out is which one, students? Suchait, Roshan, Sirisha, it is
Sporozoid.
sporozoite. Very good. Next. Extrinsic incubation period of Plasmodium. Extrinsic incubation means what? It is the time taken for the development of the Plasmodium within the mosquito, that is female Anopheles mosquito. In the mosquito, once the gametocyte enters, till it gets converted into sporozoite, how long it will take? So that we call it as what? Extrinsic incubation period. So what is the time? Which one will you opt, students? Because it has also been asked once. It is second one, 10 to 20 days. So it is, these are some of the factual questions, right? So it is 10 to 20 days. Next. You all should answer this. Crescent shaped or banana shaped gametocytes are seen in infection with which one?
Falciparum.
Very good. So it is seen with which one? Plasmodium falciparum. Like whereas in rest of the things we don't see this particular structure. So this is a blood picture showing of Plasmodium falciparum. Now, what is this blood picture it is showing, students? Now you should only try to identify and let me know. See, look at the shape of RBC. It is something oval shaped, right? Look at the shape of this RBC. How does it look?
Oval shape.
Oval shape. Then oval means done. It is oval only, right? And one bigger thing is seen. Bigger thing means it is gametocyte only. So it is a oval shaped RBC showing a gametocyte which is something round or irregular. Then it may be feature of what? Plasmodium ovale, right? In Vivax, it's a max, bigger RBC with a bigger gametocytes. It is over. Next. Urban malaria is due to which one?
Stephensi.
US. Yeah, tell me, Sirisha.
US.
Tell me. Urban malaria is due to which one shall we opt over here?
Stephensi.
Stephensi. Very good. So the first option itself is the right one. The second one, it is for rural malaria. And all these things, others they go for dengue and Japanese encephalitis. Next. Pernicious malaria is seen with. So what is the other name for malaria caused by Plasmodium falciparum? It is also called as what? Pernicious malaria. Pernicious means something like very active or highly virulent type. So pernicious malaria is the other name given for which one? Plasmodium falciparum, right? So what is the other name for Plasmodium falciparum causing malaria? It is also called as malignant. Yeah, very good. So pernicious malaria is the other name for Plasmodium falciparum. Next. The malignant tertian malaria is caused by. Now you should only answer.
Falciparum.
Falciparum. So which one?
Falciparum.
So option C. It is the answer. Next. There are four kinds of malaria that can infect humans. They are all spread by what? Mosquito, CC fly, tick bite, or the worms in the intestine.
Mosquito.
So
Mosquito bite.
very good. Next, what part of the body do the malaria parasite feed on? So they feed on which one? Intestinal lining or the muscles?
Red
Disease.
blood cell.
Red blood
Very good.
cells.
So that is the third option. Next, how long must a malaria parasite grow in its host before infection can spread to a human being? So he is basically asking about the
10
incubation
to 20.
period.
10 to
Which one?
20.
2 weeks.
2 weeks, ma'am.
Yeah, very good. So the answer is like if you see the shortest incubation to the longest incubation, shortest is for Plasmodium falciparum and longest is for what? Plasmodium
Malaria.
malaria. So if you go for somewhere
Malaria.
it is something like 2 weeks. So the answer should be which one? Second one. Next. Of the four types of malaria, Plasmodium falciparum malaria is most deadly. This type of malaria is most prevalent in what places? It is most prevalent in which one, students? Look at the world map over here.
Sub-Saharan.
Huh? Sub-Saharan region. Shall you all agree with this? Yeah. Roshan, Sirisha, Suchet. So we'll all opt for which one? First option, right? It is seen in Sub-Saharan area. Next. How soon after infection will a person feel usually to feel ill? Begin to feel ill. Like that is the incubation period he is asking again. Like after the person gets
10 days
infected.
to 4 weeks.
Which one?
10 days to 4 weeks.
First
Yeah,
option.
first one only we'll take. Again, we need to remember shortest and longest in between that. So the answer is first one only, 10 days to 4 weeks. Next. Number of diseases covered under or in NVBDCP. What is this NVDCP? National Vector
Vector-borne disease control
Disease
Disease
Control
program.
control
Program.
program.
So what are the diseases that are covered under this NVBDCP? How many diseases are there? Yes, Sirisha, Suchet, Roshan. How many?
11.
Totally there are 6 diseases till date, till
One answer.
present. Yeah.
First
So
is
this
the
first one,
Yes, ma'am.
very good. So what are those? Malaria, dengue, filariasis, Japanese encephalitis, Kala Azar, and chikungunya. So this chikungunya was lastly added. So totally how many are there? How many diseases are covered under this NVBDCP program, students? It is totally 6. This number you have to remember and you need to remember the names also. So malaria, dengue, filariasis, JE, Kala Azar, and chikungunya. And little because all these things I'll take it in the national health programs in the next sessions, but a little gist of information. This particular NVDP, it was initially started as National Malaria Control Program, that is NMCP, in the year 1953. Then what happened later in year 2003 and 2004, this national malaria program, it has been merged with other programs, that is filaria program and national kala azar program. So all this has been merged together in the year 2003 to 2004 and it has been renamed as national vector borne disease control program. So when was this program started, students? 2003 to 2004. This point you have to remember. But in the year 2005, this National Vector-Borne Disease Control Program has been merged with National Health Mission, that is NHM. So this point you have to remember. And how many diseases are covered? 6. Next. Just some short information over here. In this program, malaria, if you see, it is the most common vector borne disease. If the question is asked, which is the most common vector borne disease? It is malaria. Which is the most common viral vector borne disease or arboviral? That is arthropod borne viral disease. What is the most common in India? It is dengue. And it is the vector for that is what? Aedes aegypti. And vector for malaria is female Anopheles mosquito. And what is the vector for filariasis? Culex mosquito. And for JE, Japanese encephalitis, what is the vector, students? It is Culex species, especially Culex vishnui, pseudo vishnui and all. And Kala Azar, sandflies, Phlebotomus. Chikungunya, what is the vector? Aedes aegypti. Next. Daman, a new initiative malaria control program. It was launched by which state? So which particular state has running this particular program? DAMAN. Which is a state? I'll tell you about this program. It can be asked as a short essay or this question may be asked also. So it is a program which is currently running in Roshan.
Yes, ma'am.
In your place, this program is how far it is going on, Roshan, this program? Because
Yes,
in your
ma'am.
place only this program is took its origin. It is in Orissa. Yes, Suchet, Sirisha. So what is this program actually? It is a centrally sponsored program. Just a second. So it is nothing but the full form is Durgama Anchale Malaria Nirakaran program. So this is a full form of this particular program, and it was launched somewhere in the year 2017 in the state of Orissa. And this particular program has been planned for 5 years, and the government has given a total budget of 120 crore, and it has been implemented in nearly 8,000 villages of Orissa, and these are the names of those villages. And it is undertaken or taken care by what? It is a program under National Vector Borne Disease Control Program. Here what they will do is that active malaria surveillance will be there, and there will be mosquito control measures like ASHA health workers. They will go and protect, they will provide the mosquito nets to the people who are residing in the endemic areas of this Orissa state. And there will be regular health education regarding the sanitation and how to control the mosquito uh, population. So these are the things that are carried out in this DAMAN Daman program, right? So in which state this particular program is happening, students? In which state? So what is the answer over here, students?
Odisha.
Odisha.
Orissa. And what about in Uttar Pradesh? Sirisha, Roshan, Suchet and others? I hope if you remember, Dastak program.
Yogi Adityanath.
Yeah, very
Yes,
good.
yes,
Yogi Adityanath. So this, Yogi Adityanath has started with the Dastak program to combat what? Which one? Japanese encephalitis.
Then Japanese
That is what is the slogan?
something slow.
Darwaza katkatawo or JE ko bagawo. So the health workers, they will go to each and every house and they will knock the door and they will give the education to the people, and if required the vaccination also they will give. So the proper measures will be actively carried out and there will be active surveillance also will happen in this Dastak program. Uttar Pradesh means Dastak program for Japanese encephalitis. Orissa means anything that is for malaria. That is DAMA Daman program. So you need to remember these 2 points. So I'll conclude this class over here. So we will meet in the next session. So shall we all disperse Roshan, Suchet and Suresha?
Yes, ma'am. Thank you, ma'am.
I have doubt in one question, ma'am.
Yeah.
Ma'am, the most common plasmodium species found in India and in the world, and
Yeah.
that is Vivax, na?
See, yeah, it is Vivax only. But if you observe generally overall in the current statistics, it says about Plasmodium falciparum. The current statistics, it tells about the falciparum. In India also, if you see, oval, they say earlier it is not seen, but the recent cases they have been reported in Gujarat and Orissa. So the most common is Vivax, but the current statistics, the present one, they talk about saying that it is Plasmodium falciparum. So you should opt for the falciparum only.
Okay, ma'am.
Okay. So we'll discuss all.
Thank you,
Thank
ma'am.
you,
Bye.
ma'am.
Yeah. Okay. Thank you. Bye.
Thank you so much, madam. Thank you all.